Go.
Welcome back, guys. Thank you for sitting through our small commercial break. So we're going to go ahead and we're going to move on to talking about communication, because that's kind of a common trend that you hear about whenever you think of telemedicine. You think of telephone. I think that's a good transition to communication. So, what are some ways that we could use or better our communication process through interprofessional practice as well as with our patients? McCall, could you go ahead and expand on this topic?
Yeah, absolutely. So at Indiana State, we have physicians in Indy. So often, I think a really good way to utilize some telehealth with interprofessional communication would be by Skype calling and having them Skype in and do some kind of evaluations or consults over the phone or over video chat. That definitely would save everybody a little time and money on traveling both directions if possible. And just even, communicating better with our team physicians through texting or more phone calls and being able to communicate with them that way. Yeah.
Gotcha. Would you say that there are any barriers that might be associated with telecommunication or telecommunication?
Yeah, I definitely think there's some barriers in the fact that you don't get that hands-on feeling that I know athletic trainers like and I know physicians like, and getting to actually feel the patient and feel their energy per se, and getting that type of communication, I think really is where telecommunication fails.
True. Do you have any opinion on possible limitations among digital literacy, where the patient may not be able to use a Skype call as you would like him or her to?
Yeah, definitely. I think in a variety of settings, you may not be able to communicate. Maybe your athlete or your patient doesn't have internet at home, right? That happens more often than not in the high school setting, as they go home and they don't have that option, or that they don't really understand and the idea doesn't come across very well over a phone call. They need somebody to sit down and really show them how to take their medicine or how to do certain exercises for rehab. It's more of it depends on how they learn, and often just saying words to them doesn't really work. Lucas, you got anything on that?
Absolutely. Well, I want to talk about really how having access to internet is just so critical. And I think that until we can really be successful with telehealth and globally speaking, not just here in the United States, we have to make sure that we have good, solid access to the internet, and also making sure that it's private and that it's keeping up with HIPAA regulations. So I think that until we can get this access, and that's the best thing about telemedicine, is that you're able to get to individuals that need it the most in terms of the distance, maybe the geography. But that's also, for example, West Virginia, there's still a huge portion of the population that doesn't have access to the internet. That's just one state, for example. Even Southeastern Ohio, we had a lot of our students that didn't have access to this. So this is where I think having a central hub, having maybe like a small clinic where your patient could come in and they already have that established HIPAA compliance and they have that strong internet connection. So that's where you would still have to worry about busing or worry about some kind of transportation in order to get them there. But I think that getting 10 miles down the road to the nearest clinic, that is still going to be a much better option than traveling 4.5 hours to Indianapolis there and back, right? What do you think, Zach?
Yeah, well, one question I had for either you or McCall was, where does Skype fit into this, and relationship to the legal issue of patient privacy?
Absolutely. I don't know the answer to that, but I do know that there are more and more free applications that are out there that they are HIPAA compliant. My company, ATI Physical Therapy, and our our division, AWS, we use this. We're being trained on this right now so that we can provide care for multiple buildings while not exhausting our athletic trainers, so that we're able to also care for our individuals that are in one specific spot. So if we are trying to have multiple appointments each day, but I honestly think that would be more of the answers, that we need to provide these free phone applications. What do you think, McCall?
Yeah, everything you said is right along the lines of what I was thinking. I personally don't have a lot of experience with it. In the kind of the experience I have is pretty low key in the fact that we're the HIPAA compliance and using Skype calls isn't used as much. So those HIPAA compliance. Go ahead.
Yeah. So one of the articles I read talked about using these third-party text messaging services as a way. I think WhatsApp was one that they referenced, because now I've never used it, but from what I understand, it's almost like a de-identifier. So you can use the app, but in so many terms, you could be anonymous, as long as obviously you're not using patient's name or date of birth. But within that, it's either a de-identifier, or it's encrypted and it doesn't allow anybody to access that conversation after it's happened. So that's been in the news quite a bit, as far as like Homeland Security is concerned with that. But I think from a healthcare perspective and a patient privacy perspective, those should show some promise, in that we can feel comfortable communicating with patients in that third-party service without the risk of breach of privacy.
Absolutely. I think, Zach, that's so critical, because we as patients, we expect privacy. We expect that what's being communicated is going to stay private. And I think that as soon as you use something that doesn't allow that, that's when this whole telemedicine idea, I think, falls apart, really.
Yeah.
Right.
Okay.
So I'm going to go ahead and change our direction a little bit here, so we're not running out of time. Zach, I'm going to pull the spotlight into your direction.
Okay.
So what would you say is another avenue of telemedicine for athletic trainers that we could use in our field with our patients and such?
Like I had mentioned before at the beginning of the show, mobile apps, they are flooded into the technology market. So I've come up with a few that I'd like to talk about just briefly, and talk about some of their benefits and maybe a few of their pitfalls. The first one is Athletic Trainer Plus. It's both a website and it has mobile apps, and this allows athletic trainers to create injury playlists that consist of exercise videos that are narrated for a number of different categories, like balance, flexibility, manual therapy, and strength. And you can create these playlists for your patient and provide them with a link to that playlist, and they can access that from their mobile device or their PC. So it's compatible with all PCs and all mobile devices, or at least all smartphones. Mm-hmm. And they can watch those over and over. So if you tell them you want them to go through this playlist 2 to 3 times a week, they are not going to have to just look at a 2-dimensional picture that is often low quality. They can watch a high-def video on their mobile device, and it's going to allow them to do it correctly with the in-video instructions. It also includes aquatic therapy exercises. It's developed by athletic trainers Bill Prentice, Amanda Benson, Linda Bobo. They were all integral in developing this. It has an educational mode, so you can use this to teach other athletic trainers on how to use it. They can make up rehab plans. So I think it's important to remember, though, that is not a replacement for athletic trainers, right? So this is how I view its use is this is to extend what I do in the clinic with the patient. So if I want them to get some additional exercises and work to get better at home or at a facility where I'm not able to be there, like an aquatic center, that we can extend that treatment farther past just meeting face to face. Another one is Sway Balance. This is approved by the FDA. This is more along the lines of concussion treatment, concussion assessment. But this can also be used for balance. So I think about like lower extremity injuries. It's also been used in research it's been shown to be valid and reliable in research. So you could use this possibly to supplement or take the place of the Berg Balance Scale, which is kind of the gold standard for balance to predict falls in geriatric patients. Another one is iOrtho, and I really like this one, especially for new athletic trainers. So iOrtho app has several different options over the entire body. You can use it for manual muscle testing, functional tests, joint mobs, special tests, utilizes pictures and videos, shows you how where the hand placement goes. It gives you some of the literature that validates the test, and it also gives you specificity and sensitivity numbers on its effectiveness. So it also includes several CPRs, so like the Ottawa ankle rule and knee rules. And then the last one, I think, is really a true store and forward type of telemedicine, and that's Figure One. Figure One is kind of your medical social media. So think of it like a medical Pinterest where people, other healthcare professionals post x-rays, MRIs, pictures of injuries, illnesses, diseases, signs and symptoms, and allows other healthcare professionals to comment, to continue that conversation or build that conversation. You have to be a registered user, and it's only you're only allowed to use it if you're a medical professional. So there's kind of some checks and balances that go into there to the account. It's HIPAA compliant messaging, so we don't have to be as concerned about the patient privacy.
Awesome. I was going to ask you about the whole HIPAA, if there was any kind of compliancy for HIPAA.
Yeah.
So we got time for kind of one more bigger subject. So Lucas, I want to bring this one to you. Can you kind of talk about how we can see telemedicine as a useful technique with patient education?
Yeah, absolutely. I think that the biggest hurdle we have with this kind of education is making sure that we are educating them at an appropriate level. So making sure that we're not sending them to something that requires a college education, or we're not talking above their heads. That we want to make sure that we're coming at them and we're being simplistic. And so whenever I think about telemedicine and something that I started to develop, and I have on my YouTube channel, it's unlisted, but I have sent it from time to time. I will do exercises with a patient and then send those exercises to them where they can watch an example of this. And at times I've even had it where I would take their phone, I would put it somewhere in the clinic where we could still, it would be recording, it would be on their device of them, and then they can go in later and do that. And then also they would have a patient education handout that would have those same cues that I would use. So trying to pair those together. So I think that we need to understand where they're coming from, and we also need to understand that it's only a supplement. Once again, I think Zach said it the best, is that this is a supplement. It's not the end all be all. I'm not sending YouTube videos, or not replacing my practice. But I think that cost is a wonderful barrier, because we have it. but it is, I think, continually being challenged. Zach, with your applications, I think you mentioned that they are free to use as long as you're a registered user and go through certain aspects. One thing that I did want to mention with patient education and that I used in the high school and I'm currently using is it's called Hep2Go. It's actually an online resource. If you're just a free user, it's a great resource. That's all I used. I was trying to check it out and wait to see if it was going to be worth it for me to actually go and to upgrade this. But if you do upgrade it, the one great advantage, and going back to with telemedicine, is that it would be able to, I could text message individuals with these exercise regimens where, and my understanding is that that would also be a way of being able to, touch base with them long distance. So I think with patient education that this is something that we can do from such a far distance, and that's a huge help, especially when you only are maybe at a high school every other day, or you only check in with them once a week. So I think that all those are great things to consider in patient education. And I think with time, just like those applications that Zach was mentioning, they're going to continue to improve and they're going to continue to really help our patients, I think. I'm not sure if we lost Josh on that or not, but McCall, do you have anything to add with that?
Yeah, I think with telemedicine, you just have to be careful. As we grow and athletic trainers grow as a profession, we and even with communicating with other healthcare professionals, we just have to be careful that we're not working too far outside of and continuing to keep that work-life balance. Right. I think it's easy that now that everything is on social media and we're always on our phones, that we can get roped into answering phone calls at 2 a.m., which isn't what telehealth is. So I just want to lay that out there.
Absolutely. And I think that's absolutely going to be critical, is that we do not allow ourselves to make this something that is a burden to us as clinicians, because right. that is something that we have to mention, is that all this might be great for our patients and it might be great for us in many ways, but we already work so many hours that this should be something that complements our care, not overreaches and overbear. That's a great point, McCall.
Yeah.
Okay, well, it looks like Josh was so excited that I think he's going to go start trying to implement this in his practice. And so I think we're just about out of time. Maybe just a last couple remarks from McCall and Lucas, and then I think we'll call it a wrap.
Yeah, like I said, telemedicine is great. It's good to communicate with our physicians. It's good to communicate with our patients. And really, for me, it's an amazing tool to keep my other athletic trainer that I work with is swimming up to date. We are constantly communicating all throughout the day. And without telemedicine, without this opportunity, being able to also communicate with my patients, my job would be a lot harder.
Right.
Absolutely, and I think the very similar situation is that I think if we use this to our advantage, and I think that if we continually reflect on our practice of this, that we will continue to improve, and it won't become a burden to us as clinicians, but we'll really be able to pair it well with what we've already been doing for years. So that's pretty much what I have to sum that up. Zach, is there a final word that you want to say?
No, I mean, you guys summed it up really well. I think it's an exciting time to be a healthcare professional with all of these different technologies available. I would just caution all of us that, there's a long way to go with mobile technology. We don't have near the research to back it up quite yet as far as its evidence-based approach. So in the meantime, I think we have to look through the right lens with mobile technology, with telemedicine, and not force it until we are sure that the patient is going to be safe, that we're respecting their rights, and that we can show our patients that these things can improve their treatment outcomes.
Right. So I think it seems like we all have a pretty good grasp of how telemedicine could assist in progressing athletic training professionals. I do hope that this video cast that we've just done raises some awareness on some of the potential research that there is to be done on some of our mobile technology, communication, and patient education efforts. But that's all we have time for today. So this is Indiana State University DAT program signing off.
All right. Thanks, guys.
Thank you. Did you guys notice how I lost you again there?
Yeah.
Yep.
Yeah,
But we
we
kept
noticed.
going.
I'm
I think we did okay.
Yeah,
I'm
I thought that was
super
pretty good. Well, actually, like that was a good conversation, especially at the end there. That was pretty good.
Should I
Now-
stop recording or should I keep
Yeah,
going?
you can
Yeah.
stop. Now,